King Charles engages with veterans at Chatfield Healthcare ahead of Remembrance Day, demonstrating both his personal humor and his commitment to those who have served. During the visit on November 5th, the king met with former servicemen and women recovering from various injuries and shared insights into their healthcare experiences after leaving the military. Known for his candid and often self-deprecating style, Charles made a morbid joke while speaking to one patient, remarking on the metal plates in his own arm from a polo accident decades ago. The king's ability to mix levity with serious conversation helped ease discussions about challenging topics such as post-traumatic stress disorder and the transition from military service to civilian life. He also expressed admiration for the specialized care provided to veterans, noting the importance of community and support after leaving the forces. This visit comes at a time when Charles continues his own health treatments, including ongoing cancer care, and highlights his ongoing engagement with public service and the military community. The king's interactions underscore a blend of personal resilience, empathy, and humor, providing a relatable example of leadership while emphasizing the critical role of veteran healthcare services in the United Kingdom. King Charles visits Chatfield Healthcare in Battersea on November 5th, engaging with veterans ahead of Remembrance Day. The center provides specialized medical services for former servicemen and women, many of whom face challenges such as post-traumatic stress disorder or difficulties transitioning to civilian life. During his visit, Charles meets patients and listens attentively to their experiences, showing genuine interest in their well-being. One veteran, David Wiggins, is recovering from a broken arm caused by a bicycle accident. Charles notices the plates in Wiggins's arm and jokes that he has similar metal plates himself, referencing an old polo injury. The king's lighthearted comment, "All that is left of you when you drop dead is made in Switzerland," draws smiles and laughter, illustrating his ability to use humor to connect with people in difficult situations. This visit also allows Charles to learn more about the healthcare needs of veterans and the ways specialized services can support them. He asks detailed questions about treatments and the challenges former servicemen face, emphasizing the importance of both medical care and community support. His presence highlights his commitment to the military community while maintaining a personable and approachable demeanor. The visit reflects a combination of empathy, leadership, and relatability that defines the king's approach to public service. During his visit, King Charles engages closely with the staff at Chatfield Healthcare, asking about the challenges of treating veterans and how the medical team supports them. He speaks with Dr. Shane Barker, who explains that many former servicemen and women are reluctant to seek help because they do not want to burden others and prefer to manage their issues independently. Charles listens carefully, acknowledging the difficulty of transitioning from a military environment to civilian life, where the sense of family and unit support is no longer present. He emphasizes the importance of these specialized services and praises the dedication of healthcare providers working with veterans. The king also reflects on the significance of maintaining support systems for those who served, noting how crucial it is for them to feel understood and cared for. Despite his own ongoing treatment for cancer, he demonstrates energy and attentiveness, showing that he is fully engaged in the conversation and genuinely interested in the welfare of the patients. His humor and approachable manner help ease the atmosphere, allowing veterans to share their experiences openly. The visit illustrates the king's ongoing commitment to the military community, combining empathy, leadership, and personal connection. It highlights his understanding of both the physical and emotional needs of those who have served the nation. After sharing laughs with the veterans, King Charles continues to engage with the group, listening to their stories and acknowledging their sacrifices. He reflects on the camaraderie and support that soldiers experience during service and contrasts it with the challenges they face upon returning to civilian life. Charles emphasizes the importance of programs and specialized healthcare services that help veterans transition smoothly and cope with both physical and mental health issues. He expresses admiration for the dedication of the healthcare staff, noting how their work provides stability and reassurance for former servicemen and women. The king also addresses the broader significance of Remembrance Day, stressing the need to honor those who served and the legacy of previous generations of the royal family who participated in military service. He highlights the personal connection he feels to the veterans, understanding the sacrifices they make and the resilience required to navigate post-service life. His light-hearted comment about his own medical experiences, including the joke about being made in Switzerland, adds warmth to the interaction and helps put the veterans at ease. Throughout the visit, Charles demonstrates a combination of empathy, leadership, and relatability, reinforcing his role as a monarch who values direct engagement with the people he serves. The visit strengthens the bond between the monarchy and the veteran community. King Charles's visit with veterans highlights his commitment to acknowledging and supporting those who have served the nation. By listening to their experiences, engaging in light-hearted conversation, and recognizing the challenges they face after leaving the armed forces, he demonstrates empathy and leadership. His personal reflections and humor make him approachable, while his emphasis on specialized care and Remembrance Day ceremonies underscores the importance of honoring service and sacrifice. The visit reinforces the monarchy's connection to the military community and shows that, despite his own health challenges, the king remains dedicated to public service and the well-being of those who protect the country.